And now, our next performance will be one most of you will be familiar with. Please welcome to the stage the Lee and Queen performing her rendition of The Circle of Life. The intracranial blood supply is derived from the two internal carotid and two vertebral arteries. The branches of these vessels form an anastomotic arterial heptagon lie in the suprasellar system. But how did these vessels form? Let us go back in time to the formation of this circle of Willis, the real circle of life.
From the day the 6 branchial arches form in utero,
Intracranial vessels develop
one by one. The ICA is identified at 24 days. Circle of Willis complete by 7 weeks gestational age. The ICA forms the anterior circulation. Some say it provides 70% of total blood flow. Emboli to the ophthalmic artery, the ICA's first major branch, can cause ipsilateral transient visual loss known as amaurosis fugax in the circle of life. These are the anterior cerebral arteries, joined by the anterior communicating artery, passing over the corpus callosum to the parieto-occipital sulcus, as it supplies the medial frontal and parietal lobes. Lesions will affect the contralateral lower limb, so in the circle of the life. The largest vessel is a middle cerebral artery. Travels in the lateral sulcus to supply frontal, temporal, and insular lobes. In the dominant hemisphere also supplies Wernicke's and Broca's areas and is the intracranial artery most affected in ischemic stroke. Next we have the posterior or vertebro-basilar circulation. To the occipital lobe, cerebellum and brainstem. From the subclavians, the vertebral arteries ascend to form the single basilar, which at the pontomesencephalic junction ends. Circle of life. Posterior cerebral arteries connect to the anterior circulation via the posterior communicating arteries to supply the occipital lobe and thalamus. Infarcts may cause visual strife in the form of a contralateral homonymous hemianopia, such as the circle of life. Finally, we've reached the cerebellum, supplied by the posterior, inferior, anterior, inferior, and superior cerebellar arteries, which also supply the brainstem, the largest branch of the vertebral artery, or the pica as it's known, produces a characteristic presentation, the lateral medullary syndrome. And on these final slides, I present the intracranial blood supply, seen on CT with contrast dye. Finally, on MRI. Thank you, everybody. The Circle of Willis.